Good morning. Thank you for coming along. And I've been joined by the Minister for Housing, Minister Wynne, and Jerome Weimar, the COVID Commander, for the community update on the COVID pandemic for today. There were 246 cases reported today from yesterday of COVID-19. All were locally acquired. Of those, 121 of the cases are linked to known outbreaks and cases. This now takes us to some 1,619 active cases. All but 5 of those are locally acquired. The age breakdown continues to point to this being a pandemic of the unvaccinated. There were some 252 aged between the ages of 0 and 9, 260 between 10 and 19, 411 aged in their 20s, and 262 aged in their 30s. And when you look at the number of cases under 50, 87% of those cases are under 50 years of age. There are currently 92 people in hospital, 26 are in ICU, and 14 are on a ventilator. In regards to vaccines, yesterday was our highest number for a Sunday of vaccines delivered through our state-run clinics at 26,955. Add to that the work of our GPs, our pharmacists, primary health networks and others. We are looking for a very solid number of vaccines from yesterday. In our state-run clinics, we are now at 2.61 million vaccines being delivered through those clinics. We are now at 60.9% of first doses admitted to people over 16 in Victoria. That's a good number, but it's well on the way to 70. We've just got to keep the work going to get us there as soon as possible. And we are, of course, well on the way to our million target over 5 weeks, but we still have another 316,000 vaccines to go to get us to that milestone. Some 30,000 bookings were made yesterday into the state-run clinics, and that again was a very good number for a Sunday, but there is always more that can be done. There are currently 10,000 available first dose AstraZeneca appointments available and 1,000 available first dose Pfizer appointments available over the next 7 days. This does not include the priority program for our Year 12 students, which I'll come back to. Just to analyse a bit further the hospitalisation figures and the notion that vaccines not only keep you safe but are our pathway to supporting our public health system, our hospitals, and getting out of this pandemic, we did a bit of a breakdown again of the vaccinated status of people in hospital. Of the people in hospital yesterday, 13 in hospital were not vaccinated and were not eligible at the time they were diagnosed, under 16-year-olds. 67 in hospital were not vaccinated but had been eligible for the vaccine at the time they were diagnosed. 10 were partially vaccinated. 1 person was fully vaccinated yesterday, but the good news is that person has been discharged as well enough to go home today. So I can't reiterate this as many times as we possibly can and in as simple terms as we possibly can. This current outbreak is targeting the unvaccinated because that's where the virus will go. Our best way in which to protect ourselves, our family, our community, and to get to the other side of this is to get vaccinated and therefore protect yourself, perhaps even more importantly, do your bit to protect our public health system and make sure that any wave of the unvaccinated protects our public health system. In regards to the school blitz for VCE and final year 11 exams, those bookings opened today and the vaccinations for that start tomorrow and run until the 19th of September. Our parents, carers and families have received communications from the schools over the weekend in particular, some a little bit earlier, including the priority access booking number. So please check your emails or however else you usually get your information from the school, sometimes online, Compass, all sorts of other communication mechanisms that schools engage with their families around, making sure that those final year students get that priority access to get them into the GAT, to get them into their exams as soon as we possibly can. This also picks up our Year 11s who are completing their 3-4 subjects can also book from Wednesday. This is making sure that our Year 11s and eligible Year 11s and 12s get that certainty about making sure that their exams are going to be held, that they get the opportunity to hold the GAT, to participate in exams, and whilst we're doing it, keep both the students and the staff safe. So I just also wanted to use this as an opportunity to just reassert that if you have been vaccinated, it's still important if you show signs of coronavirus to get yourself tested, and whilst you're infinitely better in being protected and reducing your chances of hospitalisation and certainly death, you nonetheless can still, in more limited circumstances, pass the virus on. So it's still important that even as our vaccination levels grow, that we continue to be alert to the virus and to get tested with even the earliest possible symptoms becoming apparent. Before I hand over to Minister Wynne and to Jerome, I'll just point out that with Parliament this week, with multiple Cabinet meetings and subcommittees on this afternoon, we're going to try to limit this particular engagement to about an hour if we possibly can. So, Minister Wynne.
Thanks very much. Can I thank you for the opportunity to announce two important initiatives that we have committed to. The first is a new rent relief package for those who have lost income during recent lockdowns and are in rental hardship as a result. As the Minister has already indicated, the pandemic continues to have a very significant impact on Victorians who have lost work or had their hours reduced and potentially are unable to meet the cost of their rent. This program will provide a one-off grant of up to $1,500 to Victorians who have lost income as a result of the COVID pandemic and are obviously experiencing rental hardship. The one-off payment is for renters paying more than 30% of their income in rent to help maintain them in safe and affordable accommodation. Grants will be targeted to those who have lost at least 20% or more of their income from the pandemic, backdated to the 27th of May 2021. But we're also asking landlords, and the grant will be allocated to the landlord, up to $1,500. But we're also asking the landlords, as they did last year, to show a level of compassion to people who find themselves sometimes in very, very desperate circumstances, insecure work, unable to work, they've lost their hours, and we think that this is an important initiative, a targeted initiative that is actually going to make a significant difference to people's lives, because we absolutely understand just how critical it is that particularly those who are vulnerable have safe, affordable and secure housing in the private rental market. The second element that I am announcing today also is an extension of our homelessness program. As people would be aware, we have been supporting many homeless and rough sleepers now for more than 12 months through this pandemic in hotel accommodation. To date, we have moved out in the order of 1,100 people, households, into longer-term and secure housing. But there are still 1,600 people who are in the hotel program. And we want to ensure that this program, which we will extend out till the 30th of June next year, continues to support people, stabilise them and then give them a pathway out of homelessness. We want to ensure that this record investment the government is making, and I indicate that it is a further almost $45 million that we are investing in this program, does provide an essential pathway for people into long-term sustainable accommodation going forward, with the supports that people need to maintain their tenancy going forward as well. So these are initiatives that are very much targeted in the first instance to vulnerable workers, clearly who have lost income and find themselves potentially in a vulnerable situation in the private rental market, and obviously an important extension to our homeless program and rough sleeping program. Our state is providing the most comprehensive response to homelessness and rough sleeping of any state in Australia, and indeed we have had inquiries from overseas of people wanting to understand how our program is working and how they may be able to learn from our experiences here in Victoria. I welcome these two important initiatives because they absolutely go to the heart of protecting some of our most vulnerable in the community. And I think, Martin, I might call upon Jerome now.
Right. Thanks, Minister, and good morning. So 246 new cases of coronavirus in Victoria in the last 24 hours. That takes us to 1,619 active cases of COVID in the community at this point in time. As the Minister has said, this is a pandemic of the young, of essential workers and the unvaccinated, with 83% of all those new cases in the last 24 hours being aged under the age of 50. 121 of those cases have been linked, and we continue to work on acquisition source for 125 of those cases. Of the 246 cases, 129 are in our northern suburbs. In our western suburbs, we have 71 cases. In our southeast, we have 21 cases. In the inner city and inner south, we have 9 cases. In our eastern suburbs, 8 cases. There are 2 cases in the Mornington Peninsula. There is 1 case in Greater Geelong, and there are 4 cases in Shepparton, and 1 case remains under investigation. That should give us the 246. The geography, of course, is starkly familiar with what we've seen over the last week or so. Over half of our cases, or around half of our cases, are in the northern suburbs. Over a third are in our western suburbs. There are 172 active cases across the entire rest of Melbourne, and we continue to have around 128 cases in the Shepparton area. But again, day 13 testing has gone very well, and we're starting to see that number of cases reduce as we go through day by day. In terms of the other cases today, the 2 cases in the Mornington Peninsula is 1 household in Blairgowrie. We have a connection to primary close contacts of a confirmed case elsewhere in the city, and that household is isolating well. We have 1 case in Greater Geelong. That's a household primary close contact of an existing case we've known about for a while, and again, those isolation protocols are holding together well. The focus really now, in terms of the active front and the shape and morphology of this particular outbreak, is that we're continuing to see significant household transmission, particularly within our northern and western suburbs. We're also seeing significant transition, particularly in small businesses that are embedded in our community. If I look at places like Somerton Road, near Roxburgh Park and Coolaroo, we're seeing a number of small community businesses with very high levels of positive cases, both amongst their customer base and amongst their staff. What we're also seeing, of course, is those remaining essential workers that are moving around our economy. We mentioned construction sites yesterday, 81 active cases now at the Box Hill construction sites. Those essential work sites are such important places for us to protect and to ensure that the very best protocols are in place. And essential workers generally represent both a huge opportunity for us to ensure we maintain strong COVID safe protocols to minimise the onward risk of the community transmission we're seeing, but also a particular vulnerability. If essential workers aren't on top of their symptoms, are not out getting vaccinated and are not testing regularly, that presents a significant risk in terms of onward transmission. So I would urge, please, again, for those communities that are on the front line, those communities in our northern and western suburbs, we now have significant numbers of people working with you in our local public health teams, in our local health services, through councils and a whole range of other community support organisations to help you stay safe, to minimise the risk of transmission from household to household, community to community, and through your key local community services and businesses. To businesses that remain, those essential businesses that are doing such important work, the most important things that, the most important services that we all rely upon, again, please make sure your COVID safe plans are working and functioning well, that your staff are healthy and know what to do when they have symptoms, and that you're giving them every support that they need to go and do the right thing. We need to prevent onward transmission within particularly those workplace settings and out of the places where we see the active front at this point in time. In terms of a couple of key areas in terms of exposure over the last 24 hours, we have Pascoe Vale Primary School that has 4 active cases, 3 students and a member of staff. There are 93 primary close contacts. The school is now closed, and we're working through our normal contact tracing process with that school. We have a security guard at one of our testing stations at Hampstead Road in Maidstone who has tested positive. She has had 1 dose of Pfizer, but has contracted it, we understand, from community transmission. Maidstone testing station is closed for today while we do a deep clean, whilst we continue to test and ensure that the rest of our staff are able to continue to work. That work will happen over the next day or 2. And finally, regionally, we've now got 2 separate instances of truck drivers who reside in Victoria, one in Marupna near Shepparton, and one in Wodonga that I mentioned yesterday. Both truck drivers have contracted coronavirus, and based on the genomics that we're now seeing from a different source than what is currently active within Victoria, we believe both have acquired their infection interstate in New South Wales in the course of their normal working duties. And again, the testing protocols we've put in place around interstate freight are therefore very important. And my thanks to these 2 drivers for getting tested so regularly, for getting tested immediately when they had symptoms, and for isolating so well. We do have 1 onward case of transmission with the Marupna driver within their household, but again, that primary close contact was isolating properly. But it highlights again, of course, that whilst we continue to tackle the significant fire front we see here, particularly in Melbourne, we still have the risk of onward acquisition of interstate transmission from elsewhere, and hence my thanks to everybody who's working on those border protocols and all those people who are authorised workers undertaking that regular testing as part of your permit. It is very important that you do so that we minimise the chance of starting new spot fires in other parts of regional Victoria and indeed in Melbourne. We have 3 other cases in Shepparton today, and they're all primary close contacts of an unidentified case, all but isolating, and no significant additional concerns there. I mentioned yesterday in questioning that I indicated we had a case in Ballarat. Can I correct the record on that? We do have a exposure site in Ballarat which involved a nurse, a trainee nurse at the ACU. She actually resides in the western suburbs. What was travelling to Ballarat? All those exposure sites are listed, and she continues to be well. In terms of our wider testing programme, 42,500 or 42,258 tests undertaken yesterday, over 98% of those getting results back the next day. And testing is by far the most important tool for us to support the wider community, to make sure people are understanding of what their status is, and so we can put that full support around people to minimise the risk of onward spread. So again, please, wherever you are in Victoria, if you've got any symptoms or any concerns, please come forward and get tested as soon as you can. We are opening up 2 more testing centres today, one at the Broadmeadows Leisure Centre and the other at Keilor Park Basketball Stadium. Both of those will operate for the forthcoming days, again to deal with some clusters of exposures that we've seen in those areas. Finally, in terms of vaccination, over 2/3 of Victorians aged over 70 are now fully vaccinated. For those between the ages of 40 and 70, over half of them are now fully vaccinated, both doses. What's been really encouraging to see in the last few days is that we've now hit over 1/3 of 18 to 30-year-olds getting their first dose, over half of those, and almost half of those in their 30s having their first dose. and over 70% of those aged over 40 having their first dose, with over 80% of those over 60 having had their first dose. So we are starting to see those vaccination rates now rise, and we're starting to see people completing their vaccination journey. Obviously, there remains a significant way to go, but can I thank all Victorians coming forward to get their vaccinations. Obviously, we start the VCE programme today, and that's an exciting step forward for younger Victorians, and also thank all the staff working in our vaccination system, including the GPs and our pharmacists, as we do this very important job of getting us to the other side of this particular outbreak and indeed this pandemic. Finally, there is a huge amount of work going on with communities right across Victoria, and in particularly across our northern and western suburbs. Can I thank all the community leaders in their different guises, whether you're school principals, whether you're local council mayors, or whether you're community leaders of whatever colour and background. Your work is so important. The WhatsApp groups, the phone trees, the collective work across our communities to keep people safe, to keep them informed, and to make sure people make the right choices is a really important thing at this time. With the numbers we're seeing in recent days, we need to be prepared for significant community transmission to continue to occur. We need to do everything we possibly can to stop every single possible case in order to get in order to get ourselves through this over the weeks and months ahead. With that, I'll hand back to Minister Foley for questions.
Thanks, Jerome. Happy to take questions.
Is there any hope for regional Victoria to have their lockdown eased this week?
As the Premier and the Chief Health Officer have indicated, there are still plans for not a snapback, but certainly an easing of restrictions for regional Victoria, with the likely exception of the Shepparton, Goulburn Valley area because of the cluster there. And that will be focusing around support measures, wellbeing measures, and a gradual easing. It shouldn't be seen as a snapback to where we were, say, in April or May, but certainly a recognition that the chains of transmission in the regions are different, and in most of the regions, very different to what they are in metropolitan Melbourne. And the region's main risks continue to be, as we've seen with the truck drivers and others, a combination of importing the virus, particularly from New South Wales, and making sure that the metropolitan Melbourne leaks don't get into our regions.
Minister, the doses from the UK, the Pfizer doses, when do you expect them to be bookings available in the system in Victoria?
So as I understand it, they're coming in a series of flights over, well, one flight has arrived, but over coming days and weeks. They go through a batch processing check with the TGA at the Commonwealth level. We're hopeful that they will be landing in Victoria and into Victorian arms, both through our GPs and our state-run clinics, by the end of this week.
Have you got an update or any figures on how the uptake of the Year 12s making their bookings has gone?
I understand it's been extremely busy. An extremely enthusiastic group of Year 12 and Year 11s who want to have that crack at the certainty that both the GAT and the exams will bring them. I don't have exact figures, but I do understand when it went live it was extraordinarily busy. Please hang in there. There's heaps of resources going in to make sure that that targeted group of somewhere between 50 and 67,000 young people can get in, get booked and get the certainty that they're looking for.
Do we need to do anything on the capacity side, Minister? With all the vaccine supply coming in, do we have the logistical capacity at the moment to ramp up, or are there things we need to do to ramp that up?
Look, we can always look to do more. At the moment, we're still a little bit constrained by supply. We, with the notable exception of those bookings that I passed reference to early, there are plenty of valid bookings that can be done through both the state-run clinics and the GP networks now. As the Chief Health Officer has said on many occasions, the most effective vaccine is the one that's available and ready to go into your arm today. There are plenty of AZ opportunities in our state-run clinics, in our pharmacies and in our GPs. There are plenty of experts there who can take you through the very risk-based assessments that you need to go through. And we've seen more AZ in that category in Victoria than I'm advised than any other state. and that shows that Victorians want to get in and get vaccinated. In regards to what's next, with more Moderna apparently coming on supply in the not-too-distant future through pharmacies, and then hopefully even more other mRNA vaccines, together with quite a strong supply of AstraZeneca, we're always looking to further platforms that can get out the vaccines as quickly and as effectively and as safely as we possibly can.
What are some of those platforms? Are you looking at things, are you going into churches and mosques and community halls?
Well, indeed, that's precisely the kind of community engagement level that we want to make sure, particularly in those communities that are younger and therefore have come into the vaccination program later as a result of the Commonwealth's rollout program. So we've already, for instance, rolled out programs in Greek Orthodox churches, in Islander faith settings, in Hindu temples. We've got programs scheduling this week in mosques and other Islamic centres, and we'll be doing more and more of that as supply becomes available. We're also doing the outreach programs through the C19 Coalition for the Homeless and the precarious housing groups, and we're also doing things like Jabba the Bus in the Goulburn Valley, and rolling that one out starting this week. We will always look to the big numbers being done through our state-run clinics. My understanding is the Commonwealth are accrediting more and more GPs and pharmacies as more supply comes on, but we'll always look at where can we target particular arrangements, especially for those communities that have lower levels at the moment of vaccination and higher risks of acquiring the virus. So faith settings, school settings, work settings, community-based settings, we will need to ramp all of those up to get to our ambitious targets.
Minister, given we've hit 60% first dose vaccination coverage, do you expect that we could hit 70% before September 23? And if that happens, will we regain some freedoms before September 23?
So as the Premier indicated when asked about this over the weekend, we are a little bit ahead of that schedule, and I want to thank all Victorians for that effort. And the sooner we get to 71st dose vaccines, the more confidence that the public health team will have to be able to bring forward those small but important measures about relaxing the public health orders and giving Victorians due recognition for their really hard effort. And the sooner we get there, the better. The most recent assessment was as a result of a particularly strong week that we had last week in vaccines, that date is creeping forward. And I'd encourage all Victorians to continue to get vaccinated in increasing numbers, not just so that we hit 70% single dose, that we hit 80%, and then we hit 70% double dose and 80% double dose as soon as we possibly can, to bring us to the next stage of our recovery out of this global pandemic.
Minister, are you aware of any plans to mandate the vaccine for interstate truck drivers?
Well, there's already the interstate code in place that Jerome indicated that requires mandating for testing. And I know that at the national level, the industry are very strong supporters of making sure that their work crews are vaccinated. And there's lots of talk going on at really those high-risk industries about who should be next in line for vaccinations as a requirement of their important work.
Would that include truck drivers?
They're one of the groups. Clearly at the moment we've already got hotel quarantine workers, we've already got aged care workers. There's talk through the national arrangements of well progressed of disability workers. Healthcare workers have been mandated in some jurisdictions. There's a whole raft of other groups that are critical to our national infrastructure, our logistics chain, to keeping things going, that need to be vaccinated. And the employers, the representatives of the workforce and governments are well progressed in a range of discussions down those lines.
Just on the 2 truckies that contracted COVID in New South Wales, do you know if they were vaccinated, and can you shed any light on where they picked up the infection?
I don't know about we can find out about their vaccination status, but they're Victorian-based truckies, and by following their logs and their infectivity symptoms, and more importantly the genomics, it does indicate that they've picked up their virus in New South Wales.
Yeah, but do we know where? Were they in?
I'm sure we do in terms of where they've been through their logs, but I don't have that information. I'm sure we can get it for you. Southwest Sydney is one of the main freight hubs of the nation. But whether it's been regional or whether it's been in Sydney, I don't have that information, but I'm sure we can get it to you.
Are they linked, those 2 drivers?
I don't believe so, no. One's based in Wodonga and one's based in Mooroopna.
Just back on the VCE priority, we understand phone lines were overwhelmed this morning to the point that people couldn't book vaccines. Is it possible for students to walk into the safe hubs?
No. We've been pretty clear that what we want is, first and foremost, because we want an orderly process and we don't want our state hubs to become centres of the virus outbreak. So we need to manage people presenting in an orderly and timely manner. In terms of the phone system getting hammered first thing, we understand that that was the case, and just goes to show the wild enthusiasm of this group to get vaccinated and get on with the important part of Term 4 and their exams, and we welcome that. I understand things have eased up, and I would encourage people to continue to try, because the process is phone-based, so we can specifically insert those 50-ish thousand young people and about 10,000 adult supervisors and teachers involved in the process into specific measures to get them through as quickly as possible in the 50-plus state-run centres that are available to them.
Yeah, so will teachers have to have at least 1 dose of the vaccine before they're allowed to go back into the classroom, at least next year we're talking? Teachers have to have 1 dose. Will they have to?
Well, at the moment there's no plans for that arrangement to be required, but we would encourage and will continue to work through with all levels of the education centre the importance of particularly teachers at all levels, but especially for those kids under 12, the most important way that we can protect them is to have the adults who teach them, who support them, who are in their families vaccinated. That is really, really critical. So as more supply becomes available and as more certainty of supply becomes predictable, we would encourage everyone, and all of those groups are eligible now for a vaccine. We would urge them to come forward and get vaccinated if they haven't. And I'm assuming, given the very strong numbers we've seen in Victoria, quite a large number of them will already be vaccinated.
And the Pfizer supply that's coming from the UK, has that already been factored into the school blitz?
So the initial Singapore sling was the initial thing that gave us the ability to bring forward that program with certainty. The more, I think it's 1 million-ish doses, most of which is going to the GP network, but large proportion of which has come to the state-run clinic, gives us that absolute assurance that that program will be able to be delivered with clear precision and knowing that the Pfizer vaccine will be available to that group.
Will any of that UK percentage be, how is it split up between first and second doses? Because some people who are booking or having their first dose are having real difficulty booking a second dose.
The more supply we get, the more certainty we get for first and second doses. So with more supply becoming available from the UK, that further assists. With more points of distribution, with Moderna starting to come online through pharmacies, that assists. With more distribution points, with more GPs being accredited for both Pfizer and AstraZeneca, that assists. We've got to recall that simply because you're over 18 rather, you're not ineligible for AstraZeneca. The Pfizer is the preferred under the ATAGI guide, but we have seen really strong numbers of people 18 and above over the last month or so continue to come forward because for AstraZeneca or Pfizer, because they know the most effective vaccine is the one that's available now. And indeed, some international studies are starting to show that AstraZeneca has a longer enduring value. So I would encourage anyone who's over 18, who's yet to be vaccinated, to take that step, get in contact with either your trusted GP, your pharmacist or a state-run clinic and get on board, get us to 70% single dose, get us to 70% double dose, keep yourself safe, keep our community safe and get us to the other side of this really nasty pandemic.
Just on the regions quickly, are you worried we're going to see an influx of people from the city go out to the regions if they can, be able to go to the pub or anything like that?
We know that regional Victorians have worked really hard to keep their chains of transmission and virus-free status really solid. We know that metropolitan Melbourne Victorians need to follow the rules, and we'll work closely with local government, Victoria Police and others to make sure that as things are slightly eased in the regions, with the exception of Shepparton, that enforcement and protection will be there. There's also a role for local communities to enforce that, and ultimately, as we move towards higher and higher levels of vaccination, that system of hopefully linking vaccination status to access to sites will further assist in identifying the appropriate location of community members to make sure they follow the rules.
Grey nomads coming back from Queensland have 24 hours to transit through New South Wales. They say that that's unworkable and can be dangerous. Is there any other way that they can get around it? They can sleep in their caravans?
Yeah. I've had a number of conversations with people who have shared their experiences on those with me. It really is a challenge in some circumstances, and I understand why. We've seen hundreds and hundreds and hundreds of people successfully do that so far with no incidents, and it's all about making sure we manage the risks. So I understand the challenges, but I would encourage those grey nomads to make sure that their safe return to Victoria, as per their permit conditions, is done in a measured and safe way. But we genuinely believe, from all the advice that we've been able to garner from road safety and others, that this is possibly being done, and it is being done by quite a large number of people.
What date can the regions expect an announcement?
We'll continue to work through those arrangements to the public health team, and as Premier and the Chief Health Officer has indicated, as soon as those decisions are made, we'll be sharing those with the people of Victoria, and particularly the people of regional Victoria. Sure.
Just one question very quickly, Minister. We're moving towards vaccine passports, and so you can open up for people who are double vaxxed. There is a black market emerging, especially overseas, for these vaccine passports. How important is that we have a system that we have faith in that can be utilised in Australia? It's
very important. We know that with advances in digital security and digital technology that it is possible, and particularly Victoria and New South Wales are working very closely on a consistent, safe and foolproof scheme to make sure that that precisely happens, and we look forward to that work continuing. We know that there's always the risks of cyber security issues and counterfeits being produced, but we're confident from all the great work that's been done across those two jurisdictions that that will be able to be accounted for.
Sorry, just one more for you, Minister. Now that we're getting more supply, will you look at reducing the time between Pfizer doses?
It will depend. It's all about making sure that we get as many people as possibly through as we can. At the moment, the period between first and second doses for both Pfizer and AstraZeneca is 6 weeks, and that's based on the optimum number of vaccines getting into the maximum number of arms. If that position changes, and subject to public health team's advice, then of course we'd look at it. But there's no plans for that at the moment. So I would urge anyone who's just thinking about will they hold back for one or the other, the best vaccine is the one you can get today. If you haven't got in contact with your GP, your pharmacist or a state-run clinic, please do so now. It's the best way to protect yourself. That's the best way to get us out of this global pandemic.
So have you know the time when Moderna?
No, but I'm sure I can find out for you. I wouldn't like to guess, but we'll get that one for you. Jerome?
Just Paul, just on vaccination numbers, particularly for the VCE students looking to book their vaccination. So 30,000 calls received this morning between 8 and 11 o'clock. So my thanks to everybody for hitting the phones nice and early. Can I just assure every VCE student, and I've got one at home myself, there is a dose there set aside for you between the 7th and the 19th of September. If you're a Year 11 student taking a VCE subject, you can phone from Wednesday. So we are trying to get the Year 12s sort of booked in over the next 3 days. But you can book in today, you can book in tomorrow, you can book in Wednesday as a Year 12 student. So there is no frantic rush. The doses will be set aside for you. We will make sure we get everybody done before the 19th of September. Anybody who wants to get it done can get it done so they can safely take their GAT with at least one dose of vaccine in their system. Paul.
I know you talked about non-compliance in construction over the weekend. Is there evidence that the 25% capacity limit is not being followed in a kind of widespread way? Or?
No, that's not the concern we've got. And yesterday I talked a bit around, over 600 visits to construction sites that we've undertaken through our various teams over the last 4 or 5 weeks. Over a really good level of compliance, but we are finding about 1 in 10 sites where we're not seeing either mask wearing being adhered to, social distancing not being maintained as effectively as we would ask them to in their COVID-safe plans, and in some cases COVID-safe plans just not being in the right shape. So we haven't got concerns around the density limits, but there are a number of sites, a small number of sites, where those good principles that the industry as a whole has adopted over a year now are not being adhered to. And this is about, we rely upon our essential workers to do not only the most important jobs at this difficult time, but also to do them as safely as possible. The last thing we want is other work sites having to be closed down because we've got significant COVID outbreaks that we have to put the lid onto.
And the detainees at the facility,
yeah.
You made a comment on the weekend that most of them have been tested. There are refugee advocates today saying that they haven't been tested yet.
Right.
Are you confident that the detainees themselves have been tested?
So I haven't got the details, Paul, on the testing status of the detainees, but happy to go away and have a look at that. It's obviously a Commonwealth responsibility for the management of that particular site. What I can confirm is we've got one positive identified case in a security worker who works on the outside of the vicinity. My understanding is that individual does not have contact with the internal staff that circulate within the building, but happy to come back and get confirmation on the testing status of the people who are detained there.
Are you aware of a positive case at a 000 call centre in Williams Landing?
No, I'm not. No, happy to go out and find about that, but that's news to me.
Has there been any update on the Acquire call centre in St Kilda Road? We've had people talking about a number of breaches about packed conference rooms and so forth, and guidelines not being adhered to. Have you got any update there for us?
Yeah, I think I haven't got the number of cases in my head, but I think at least 20 cases coming out of the Acquire call centre in St Kilda. Obviously, call centre spread across a number of sites, and we've got a number of concerns about the COVID-safe protocols being employed by that facility. A number of the staff were working from home, we understand, but significant numbers of staff still coming in, and shared training facilities and a number of other breaches that we're looking at and concerned about. So that investigation work carries on. As I said yesterday, we'll continue to work with them. We expect every operator, regardless of who they work for and what they do, to maintain those high standards for good reason. And the Acquire setup is a good example of, or it highlights the risk again, that one positive COVID case not detected, 20 staff now, that site largely shut down, and a significant impact on the business and the employees there.
You said there's been significant transmission in households at the moment, especially in the northern suburbs and the western suburbs.
Yep.
What are people telling your contact tracers about the transmission in those households? Are they unaware that they were able to about the COVID rules, or were they aware and these are significant breaches that they were?
Look, I think we're seeing a number of things. It's no one simple answer. What we're seeing is we are seeing cases of COVID coming into households and a very high attack rate of the virus into those households, and we've seen this all the way from the beginning of August, with a disproportionately larger families involved in the early phase phase of this outbreak, younger families involved, and therefore, as a result, fewer having been vaccinated, the virus is spreading far more quickly through larger family settings. That's one thing we're absolutely seeing. I think, secondly, we continue to see evidence of household-to-household transmission through what appears to be quite, minor, inadvertent, and to many people, I'm sure, innocuous contact between households. We're seeing the virus jump exceptionally easily and exceptionally quickly. We've seen examples of family members providing childcare support to other family members, to other household members, and the virus transmitting through children and through that inadvertent contact, and suddenly you've got 4 or 5 households impacted. And we're seeing community transmission through particularly community-based businesses, smaller retail businesses, smaller shops, lots of frequent contact. That's where we're seeing transmission as well. Now, Delta is exceptionally difficult to track down. We've been talking about Delta now for, 3 months. We've been talking about fleeting transmission, casual transmission, people not knowing each other when they transmit it to each other. All of those are features of what we continue to see, and that's what makes it really hard to stop in its tracks. And we're also seeing some deliberate cases of breaches of the CHO directions. We are seeing a small number, but difficult gatherings of groups of people together, and that, of course, when we're seeing those kind of things, and that's where the virus spreads, that just makes it that much harder for our contact tracers to stop the thing in its tracks.
Jerome, we've heard from an epidemiologist today who believes that Victoria's daily case numbers may not peak until we reach thousands, until vaccines kick in. What measures are in place to ramp up capacity for hospitals for testing for contact tracing? Yeah,
so look, we're working on a number of fronts now to ensure that we can both look after those who increasingly are becoming sick with coronavirus and having to be taken into hospital. Again, today's numbers, we're seeing a not fast but a consistent rise in the increase of people going into hospital and the increase in the number of people going into intensive care. The Minister's taken us through a young age profile and a young and unvaccinated age profile. So that's a real and present danger. And as our overall case numbers increase, we expect to see ongoing increases of people that are going to be hospitalised. This week we're bringing on more dedicated COVID wards at a number of our health services. We have a plan going forward over the weeks and months ahead that should these case numbers not start to turn around, then we will continue to provide more capacity in our health services to look after people who become seriously ill. We've also shifted over the last 4 or 5 days, we've really shifted our community response into those communities and suburbs where we're seeing the highest levels of community transmission. So whilst we continue to drive our contact tracing activities, it's around how we wrap around support to those communities where the community transmission is the greatest to ensure that people are getting localised support in terms of food and welfare relief to make sure that they get everything they need to isolate as safely as possible, and that we're making people aware in those very communities of the ongoing risk of COVID running through their communities. And that's a work that's being shared not only by our health teams, our local public health teams, health services, local councils, and a whole range of other agencies.
And I know officials have stopped, as of last week, releasing how many people are spending time in the community while infectious.
Sure.
Are contact tracers falling behind?
No, so every single case of every single positive case we see is interviewed and engaged with within 24 hours. We're right on top of those metrics. Every case we speak to, we do our best to get a hold of as many primary close contacts as we can, and to get hold of those primary close contacts and to make sure they isolate. So all of both our national metrics and our statewide metrics continue to be positive or continue to be green in terms of being right on top of managing the positive cases coming out of this outbreak. What we do have to recognise is that with significant community transmission in those northern and western suburbs in particular, the number of people in isolation becomes an increasingly less important metric, because actually we're dealing with significantly large groups of households, significant transmission in public settings, and an increasing number of people who are active in the community whilst they're infectious. That is a regrettable feature of what we're now dealing with. So this thing is transitioning. It is obviously much easier for all of us to stay on top of those identified isolated chains of transmission. So if I look at the Box Hill construction site, it's very straightforward. If I look at Pascoe Vale Primary School as an exposure site, very straightforward. When you're in a community where you've got multiple chains of transmission of multiple generations all interacting with each other, the clarity is far less, and as a result we're focusing much more on how we support people in those communities to both isolate as safely as they possibly can and to minimise that onward transmission.
Are there big outbreaks you're dealing with in the north or west? Are there any exposure sites that have spawned lots of cases, or is it just lots of households, lots of small?
No, and again, if you look at the total number, we've got 11,000 primary close contacts at this point in time, and the relatively small ratio of positive cases to primary close contacts reflects that we're not seeing these big super spreading sites. We're not seeing Amy Park and MCG because we've been in lockdown for the last, 4 weeks, 5 weeks. So we're not seeing those big acceleration events. We're not seeing big super spreading events. What we're seeing is lots of individualised movement. What we're seeing is lots of small levels of people going out and doing essential shopping, people going out and doing essential work, but still transmitting the virus. And it goes back to that conversation over the last couple of weeks. People are presenting late in their infectious period. They're presenting late after symptoms, and as a result, they're leaving behind them a whole chain of transmission that we then have to run around to try and get hold of.
Are you encountering, I guess, the limits of behavioural change in some of these communities? Have you found that there is a limit on how much change in the activities in these communities you can actually achieve through press conferences, because there's ingrained cultural differences about how people interact and live?
Listen, look, I think much as we spend our time at these press conferences, and obviously they're the most important thing in the world to do, there is a huge amount of engagement and communication that goes on outside of this forum. No, I appreciate that, and the level of contact we've got with people at an individual level, so that day-to-day contact with literally now thousands of people who've either positive contact or who are primary close contacts or who are positive cases. There's a vast array of communication going on there, as there is in terms of endless amounts of community engagement through a whole range of different channels. That's the really important ground. But to your point, Paul, we are absolutely encountering fatigue. I think everybody in Victoria has had enough of this entire discussion. Everybody in Victoria wants this to be over, and we are absolutely seeing people saying, it's just too hard, I can't do this anymore, and we're seeing small breaches here and there of all those rules that have held us back for so long. And the frustration, I think, we're battering fatigue and frustration at the same time. So this is absolutely collectively within our abilities to slow down and to control, whilst that vaccination program drives on. If fatigue overcomes frustration, then what we'll see is the number of cases will continue to increase, all those small breaches will continue to spread the virus, and at some point we'll start to see that spread beyond those inner northern and inner western suburbs into much broader settings. The consequence of that is far larger numbers of people being positive, far larger numbers of people going to hospital, and far larger numbers of people ending up in intensive care and in a really bad place.
Has there been any updates on Audi Barcel, if she's any charges?
I'm not following her at the moment, so no other update on her.
Just on ICU, Jerome.
Yeah.
Is there anything can you explain to us the preparedness, what work is going on in that space behind the scenes, operationally at hospitals?
Sure.
What are you guys thinking about, and what do you believe the ICU can surge up to? Is it 1,600? Is that the number?
Sure. So, Paul, happy to come back maybe through some colleagues over the coming days and give you a longer briefing around our preparations for hospitals, health services and ICU. But can I just say, firstly, literally right now we have hundreds of clinical staff, nursing staff and doctors looking after some very, very sick people in a number of health services across the state who are dealing with COVID and other conditions, not just COVID. So they're working incredibly hard. All of our health service staff are now working in far higher levels of PPE and under far more difficult conditions than they were even 5 or 6 weeks ago. And they're now doing the preparation work that says, how do we create additional ward capacity for COVID patients? How do we create additional ICU capacity for COVID patients? All that work's underway, so we've got good headroom at this point in time for the projections we have to have in terms of the increases in both overall patients going into hospital and into ICU. And that work will continue over the weeks ahead. But happy to arrange for one of our colleagues to give you a more detailed briefing on what that looks like.
Sorry, can I just ask probably one more?
Sure.
Sorry, I know you've got to get going, but just a quick one. What do you make of the developments in the Liberal Party this morning?
Oh, look, the Victorian government, indeed the Victorian community, have got one focus. That is to beat this pandemic, to do it through a combination of getting vaccinated and following the public health rules. Everything else is an irrelevancy. So I've got no comment on that set of arrangements. All good? Thanks, everyone.